Good morning.
We'll bring you in early because I saw you click in.
We'll bring Joe Rouse in early, the head of the Westfield Health Department. Good morning, Joe.
Good morning.
Morning, Joe.
I can't answer that question. Good thing I know it because you really got me blindsided there. So.
Sorry. Well, you know what? We were talking about how this is every other epidemic type thing has been named after the region in which it initiated. And the PC crowd, and I hate throwing politics in this, but the PC crowd saying, well, you can't call it the Wuhan flu because that's racist. And I'm like, no. The people of Old Lyme don't care that they call it Lyme disease.
Right? Well, you would think that with this one, 100 years ago, Spanish flu was because it originated in Spain. So that's not true. What it really means is that, remember, we were in a war at the time. And in that war, the Spaniards, or the country of Spain, was kind of like, what do they say, neutral, or not really taking sides in the whole thing.
Yep.
With all of the other countries that were involved with the war, there was essentially not necessarily a gag order, but they weren't allowed to report on certain things. So the only ones that had the liberty to report on the influenza of the day were the journalists from Spain. So all of that news information generated initially out of the journalists from Spain. Therefore, they called it the Spanish flu.
Okay,
Kathy confirmed.
Isn't that what I just told you?
Yes, you did. That means I have it confirmed from a credible source. So we're going to go with that story because it's been confirmed by two sources.
So it's
wait.
It's the one exception, though.
What?
Am I not credible?
Yes, but you have to check your sources. See, you have to have more than one source before you put it all over the internet, right, Joe?
I do.
Yeah, I'm just.
Without if I did not believe it.
I'm just glad that my story matched up with Kathy.
But it is.
No,
The
truth is the truth.
It's one exception. All right. Ebola still came from Ebola. I mean, I could list off more of them if I had woken up a little earlier today.
I'd love to run the Bill Maher. If you look on the internet on his channel for his show, there's a couple of swears in it, so I can't run it on air here. But it in the same show where he smashes Trump for his response time or lack thereof, he also blasts the other side of the house on their call, saying that you have to say it's just COVID instead of the Wuhan flu. I don't know. It's the whole fact that, what you're doing on the public health side, doing straight facts and things like that, is getting muddied by all the other, I just call it noise now. I don't even bother with it anymore.
Yeah, it's there's a pandemic of misinformation going around too, not just the virus.
Yay! I love it.
So we know that we have to keep at this pace right now, Joe. We hear, okay, we've flattened out a little bit, but we still have a ways to go, I would say.
You would be right.
Mm-hmm.
So, every day we look at, depending on what our numbers are, and numbers throughout the state, not just Westfield, but, you try and extrapolate with these new models every day and try and figure out when we're going to be on that decline, how steep that decline is. And there's there's different schools of thought on that. So common right now is what we're looking at is it took us 6 weeks to get to surge or to peak. It would make sense that it would take that long again until we're down to a point where people could be comfortable in resuming their normal activities. So that remains to be seen whether that's true, because what you might also see, another model I saw yesterday was, and this actually made sense too, is that the less people who you have infected, the less new cases that you have coming in. So as you're on the way down, it's like the opposite of on the way up, where you start off with a few cases, and then the more and more people that get it, the more and more people that get it. And that gets you up to where you're at capacity. So on the way down, we might see a better, sharper decline, just because, again, less people getting sick, less people transmitting, less people symptomatic. And so instead of 6 weeks, maybe it'll be 3, or maybe it'll be 4. But that's the model du jour right now, and that could all quickly change in 2 days. So we'll just keep track of it.
And as it stands right now, then using that model, that puts us into June.
Yeah, and I'm gonna be
Which
very
is
interested.
which is what a few reports were saying a few weeks ago. This is likely in Western Mass to go until June.
Well, Kenny, the thing is that people are sick of it, okay, and the media is trying to get away from the mundane, same old stories. That's their job, right? They have to sell time, and they have to sell ads.
And Joe,
And
to be honest with you, I'm tired of reporting on it, but I have to.
You have to. You definitely have to. We have
Yeah.
to stay diligent because, this has the potential to do a horrible rebound that's going to be even worse than what we originally saw.
Go on.
Now, that can be prevented, certainly. But if you start now just trying to will this away, that's not going to work. Science doesn't work that way.
I'm not trying to throw you a hard ball with this one, but I'm reading so many different things on social media. Did Westfield tell Walmart how to mark off their store?
Yeah. So what happened was a lot of people think this went through the mayor's office, but it didn't. It went through the health department. And what happened was we were just getting an enormous amount of complaints from customers or employees that were at Walmart, seeing it being sort of a place of congregation and socializing, because really nobody had anything else to do. So
Yeah, bring the family over to Wally.
yeah, so unfortunately, that was investigated and substantiated, and so it wasn't just based off of rumor or reports that we got from people. We actually sent our inspectors in to observe what the conditions were. And not only was there that element going on, there was also a huge lack of social distancing. There were people just not observing the general precautions. So we wound up giving them an order that said, as did Chicopee, you have to cordon off all of the non-essential areas. And we didn't define to them what that meant. We just left that up to them. And I think they probably went based on the model that Chicopee used. So it was no more non-essential sales, and you have to limit your occupancy to 200 people. Now, 200 people for Walmart and that size of a store is way, way less than the new guidelines, which is 40% of your maximum.
Yeah,
occupancy.
200. That must be 5% of the FCO of that building.
Yeah, exactly.
Yeah.
So, for them to get down to 200 people, it's a real challenge for them to keep that other many people outside. So that's what we had to do, and we're ready to work with them because they have been relatively good lately, to see if we could maybe get them to agree to some additional conditions, and therefore we could bump up their occupancy. Does that answer your question?
All right.
Actually it does.
We
Yeah.
got it right from the horse's mouth then.
Well, and it's also
Right.
dispelling all the rumors and frankly some of the BS out there.
Yeah, and also one other thing, because I know people were saying they were upset about Walmart was back and forth with the non-essential sales. And what happened was we had issued them that order because of the activity we observed going on there, and that we needed to really curtail the number of people that were in there congregating. Then the state came out with the new rule for grocery stores that you could only have 40% of your max occupancy as your load of people. Walmart then determined that they were a grocery store. And so they removed all of the cordoned off areas for the non-essentials, and they just went by the rule of, well, we'll have 40% of our max occupancy in here, and it doesn't work that way. So they actually went on for a few days being able to sell non-essentials before we circled back around and said, Walmart's not a grocery store, no more than they are a shoe store or a clothing store or a sporting goods store. I mean, you can't just decide what you are based on what you sell. There's a definition. So then we had to say to them, okay, we never rescinded that original order, and you have to go back to that. So that's what they did.
Gotcha. All right, you heard it here officially here on Ken's Den. So status quo pretty much as the city is going forward as it has the past couple of weeks.
Yeah, so I think I mentioned it last time, and even the last few weeks, we haven't necessarily been seeing less cases, but we've been seeing less cases in the general public. So we've had some trouble with some local congregate living facilities, assisted living, nursing homes. That makes our numbers look a little bit higher than they are actually, and for people, single family homes are spread out throughout the city. So, but we're still able to investigate all of those every day. Quarantine the contacts, and so it's not quite status quo. I still feel like a one-armed paper hanger, stockbroker, air traffic controller all at the same time.
Hey, Joe.
Yeah.
Are assisted livings and like apartment blocks and things like that, are those going to be problem spots going forward? Are those going to be the biggest problem spots?
Well, I think that from the first one that we had, it's kind of lesson learned about what the problem was there. So moving forward, we're hoping that's not going to be true, because we now have the assistance through a modification of a state order, so that we can use the National Guard to do testing in facilities if we see a cluster.
Okay.
So hopefully it won't get to the extent where we're going to have these huge numbers in other nursing homes. I mean, we do have another one now where there's a cluster, and we're working on it. But yeah, I mean, it's hit or miss really with that, Pete. We're trying everything that we can, especially with the employees. I mean, you got to remember, a lot of these nursing homes, these people don't leave there. So the only way they contract it is by it being brought in.
Right.
And not brought in by necessarily family, but brought in and maybe spread around by, could even be asymptomatic employees.
Well, I think that's the biggest problem now. So many people are contracting and are asymptomatic, and they don't know any better, because they're just and then they're they're not practicing procedures because they don't think they have anything, and that's how it spreads easily.
Mm-hmm.
And
yep.
I
so
think,
like they said that.
And I think with the elderly population, it doesn't take a lot of viral load to get them sick.
Correct. Yeah, so that was the problem in the first case, is that you have to really now take extra precautions with those highly susceptible populations. So that's the direction that the facilities are given now, and other things that they've already been doing, like just keeping out people. I mean, you have to, because that really, once somebody gets it in one of those places, it spreads like wildfire.
So I got about another minute or so for you, Joe. This is usually the time when you're in the studio that I let you get up on your soapbox. So here's your opportunity for Tuesday morning to do your plead to the folks of Westfield.
Okay, so there's a couple things, and a lot of questions about masks. So I'll just cover that real quick. So what you got to understand is, and people are saying now, why doesn't Westfield have a policy where everybody needs to wear masks going out in public? Mm-hmm. So what I would say to that is, even though other cities and towns have done that, I'm not quite there yet, because there's more information that needs to get out to people before we adopt that as a policy. It's not the be-all to end-all. Mm-hmm. Wearing a cloth mask is not the thing that's going to prevent you from getting coronavirus. So it's really the cloth masks especially can be effective for preventing the spread from asymptomatic or pre-symptomatic people. Someone who's symptomatic with COVID-19, those cloth masks are really not doing any good. Mm-hmm. So, but fortunately, there's other ways to protect. Like if someone's symptomatic, even a surgical mask will do better. But the cloth masks right now, whereas, like I keep saying, they don't hurt, but it's not the be-all to end-all. And when you get people that put a mask on and think that they're then protected, that false sense of security is dangerous. Mm-hmm. And we need to make sure that people understand this mask is not preventing you from contracting the virus. This mask is intended to prevent you from spreading it. Mm-hmm. And again, if you're symptomatic, that's probably not going to even work anyway. The number one thing that people need to maintain, social distancing, is the thing that has been found to be the most effective. Again, the masks can't hurt. It's nice. People like them. But don't think that, that's the thing that's going to keep you from getting it. So we got to get more information out like that to people. It's sound advice to wear it. Even the CDC will recommend it for people to protect the spread. But still, we're back to the same old thing. Social distancing, wash your hands, cough or sneeze into your elbow, don't touch your face, and stay home until we get this whole thing on the big downside, on the steep slope.
Mm-hmm.
That's about it. That's all I got.
All right. Great information with the masks as well. Because one week you hear they don't do anything, another week you hear, okay, well, you need to have one.
Yeah, well,
go ahead.
The bottom line with that is that there's just not enough information out there scientifically to weigh in on it. So in the meantime, you just say, let's pretend like they're helpful, certainly, but don't rely on that. Don't anybody think that just because you're at the grocery store with a cloth mask on that you're protected.
Mm-hmm.
You still have eyes that are exposed, touch surfaces, and everything else.
Mm-hmm. Excellent. Joe Rouse, I want to thank you for giving us a call this morning.
Yeah, no problem. Sorry I couldn't be there, but maybe next time.
All right. I can arrange it. We have ways of making things happen.
Okay, thank you.
All right. All right. I'll be cutting this out of the broadcast and sharing it on social media to get your message out.
Sounds good.
All right. Thank you, Joe.
Stay healthy, my friends.
Thanks.
See ya.
All right. And I think I heard something else ringing over in the control room, Pete. Okay. All right. Is my den mother still with me?
I am here.
All right. So that was some pretty good information we got from Joe.
Yes, it was. It was very good. He always has it right on the money. I appreciate you having him in.
Mm-hmm. Excellent. How are we, Pete? Okay. I heard you through the wall, but not through the mic.
Sorry, we're good.
All right.
I turned my mic down to talk to the person on the phone, and then I got to turn it back up.
All right. So on the phone now, our weekly chat, Mayor of Westfield, Don Humiston. Good morning, Don.
Good morning,
Ted,
Don.
good morning.
All right. First off, but before we even get into anything city and COVID, two things I have for you: condolences on your uncle, and also,
thank you.
and also, how are you feeling?
Oh, I'm feeling fine. Thank you.
Mm-hmm.
I had a chance to go over to Bay State Medical Center ER last week and go through the ER process to get checked out for COVID myself because I was feeling short of breath. And I was talking to Mike Knappich, and he's like, one of the doctors says that could be a symptom. You ought to get checked out. I said, well, I don't want to get, I don't want to go through all that problem. I don't have any other symptoms.
Mm-hmm.
He's like, well, you should come over anyway. So I did. He set it up for me, and I got in. And then they checked me out, and they said, well, that's good, but you still have shortness of breath. So I stayed in Bay State for a couple of days before I came home.
Mm-hmm.
And I got to watch from the perspective of a patient what a hospital goes through during, a major, I guess, pandemic. It was really fascinating.
Mm-hmm. So
because I was deemed after the test not to have COVID, they put me in a part of the hospital where all the non-COVID patients were.
Uh-huh.
So even though my nurses and doctors and stuff still wore masks and gloves and stuff like that, they didn't have the full PPE. They weren't wearing the gowns and the shield and stuff like that.
Mm-hmm.
It was really fascinating to watch.
So what was? Tell me where your mind was at when you were going through this, because I know in my mind I'd be saying, well, geez, if I'm walking in here without COVID, am I going to get it now because I'm here?
Well, that's exactly what I thought too. Because again, it's just what Joe said, right? It's not the people that have it that you worry about. It's the asymptomatic folks who don't have it, or who have it and don't have any signs of it. So even though I felt like everybody was taking the proper precautions, you still see a ton of people. Everybody who brings in, they bring their food in, they come in and bring their medications in or whatever. You see a lot of people during the day. And they're not necessarily keeping the distance. They're getting right up close to you, take your blood pressure and things like that. So haven't had a chance to talk to Joe yet, but I always love listening to him because he's very reassuring. He's also really knowledgeable. But in conversations we've had in the past, I just know that, after being at Bay State for a while, I should just lay low and not, get back out there in the community in case I was exposed to something. So the only people that are in danger right now are Janice and Quinn, as I'm here at the house.
Mm-hmm. So that
most of the meetings I could do over the phone.
That experience then definitely gave you a completely different perspective on all this.
Yeah, and I'm even more impressed because I tell you what, the nurses, mainly the people I dealt with were nurses. I didn't have a lot of doctors and folks like that or specialists or anything like that, but they are working. They're working round the clock through really adverse conditions.
Mm-hmm.
Everything's moved around. They're not in their usual places, and so from the ER to the floors, they're not. Things aren't routine. Everything is very emergency focused,
mm-hmm.
and yet they're still doing an amazing job. And try to be a good patient, try to be funny, try to be nice, try to give them something. They don't go, oh God, I got to see that guy in room 234 right now. And it was fun because I got a chance to. I met a couple of Westfield nurses who were from Westfield,
mm-hmm.
a couple of people that were from Southwick, and then a lot of other people from all over the Pioneer Valley, and they're just really good. I asked everybody I met how long they'd been nursing, how long they'd worked at Bay State, and what kind of things they did, and I was just really impressed with the dedication of the folks that work there.
Yeah, when my father went into Bay State a few months ago, I was super impressed because I was actually there several times for several hours, and I saw everything going on, and I had no issue leaving there, knowing that he was getting superb care.
Right.
All right.
Right, it's really impressive too. I mean, you watch all the medical shows on TV,
mm-hmm.
and you kind of watch stuff in real life.
Yeah.
See what the difference is.
Yeah. So how is City Hall doing now that it's been almost vacant for almost a month now?
Well, it still goes on. Most of what we're doing now is being done over the phone. Our meetings are all where we normally have a conference. We now have it either through Zoom or through, just a phone-in conference call.
Mm-hmm.
We're still doing things. Community development just released a round of block grants to businesses, small businesses in Westfield,
mm-hmm.
To help them get through this. I don't know what to call it. This downturn in our economy, this drastic downturn.
Right.
To help keep them alive for a couple more months,
mm-hmm.
because that's what we want. We want these small businesses to survive.
Mm-hmm. Yeah, and you did mention there that the small businesses, people should be getting, owners of small businesses, I believe, should be getting in contact with Pete Miller because I believe there's some funding from the CARE Act that goes to local businesses.
Yeah, I'm not sure if that round has passed or not, but do call the community development office if you've got any questions.
Mm-hmm.
You can get the information off of our website, too, which is cityofwestfield.org.
Mm-hmm.
Cityofwestfield.org has the information on it, too. But you can also call the office as well.
Mm-hmm. And I think the realization has finally hit us that the schools are just not opening up at all now this year.
Yeah, that decision was made last week. The governor kind of came out with it, but we sort of said, I think I said to you last week on the show that as Boston goes, so goes probably the rest of the state. And Mayor Walsh always said he didn't think that people were going to go back to school for the rest of the year.
Mm-hmm. How often are you hearing from Zaporowski?
Oh, all the time. We actually, the superintendent's in on, there's a group of us that talk like almost every day.
Mm-hmm.
Through conference calls, so it's really good. And we check in, like we go around the table with Tim Wiggs, we go around the table with Joe Rouse, or Dan Malvetta, with Stefan, we go with Chris Willenberg, the airport manager, and folks at DPW with the Phillips shop. So we're trying to just stay on top of all the different functions of city government. You know who I'm meeting a lot with now is the department heads about the city budget.
Mm-hmm.
So Chris Caputo, our city auditor, Matt Barnes, the treasurer. We're always talking about sadly, unfortunately, the condition of our receipts and their returns. And I don't blame people right now. They're not paying their taxes because they're out of work.
Yeah, May is budget time with the council, isn't it?
It is. So
Oh.
we're going to get ready to bring that to the council soon. And we've already given them the heads up. I've talked to, obviously, Councilor Figge and Councilor Bean, who's our president, and said, hey, look, you obviously know this from what you read in the papers, but it is definitely impacting us locally. State aid is down. Well, just think about it. Think about meals tax is down. Gasoline tax is down. Excise tax is down. What else? Hotel, motel tax is down. It remains to be seen that our property tax will be down. I guess a lot of the property tax is paid, through your banks and escrow, but
Right.
it definitely will be lower than usual. And of course, state aid is down.
Oh, just a quick programming note
Here is down.
for both of you. Zap will be on with Harry Rock tomorrow. Just to let you guys know, Zap's on for the whole show with Harry Rock, so he'll be covering, I guess, in depth of what's going on with the schools.
Yeah, and of course we're trying to figure out what do we do with this year's seniors, and how do we celebrate that, and do something so that their year just didn't end. How do we recognize the seniors without violating protocol, without getting a bunch of people together? What can we do to celebrate them? There's a lot of ideas from other communities as well. And then I'm also in conversations with like Mayor View in Chicopee or the mayors of the other communities around here to see what they're doing, like Bill Sabelli over in Agawam, for example, or Mayor Morris over in Holyoke, or obviously Bob Sarno, because we want to keep in touch with each other about what the local mayors are, what decisions they're making.
Well, Mayor, you have the folks here at Community Programming if you need a call on us to make anything happen or work with a solution to graduation.
Good. And I continue to applaud you because there's a core group of people in the city that listen to your show and are well informed because of it. I wish my biggest frustration as mayor has been that it's so hard to get information out to people because nobody listens to just one source. They all have each of the sources. People don't hear the news. So we try to drive people to the website, or we try to drive people to newspapers, or the television news, or Channel 15, but it's difficult. I will tell you, I think tomorrow morning, I think it's at 11. We're doing Hey, Pete, is it 11 o'clock we're doing the roundtable informational session?
Let me look on my calendar real quick. I believe you are correct, though. Hold on one sec.
Yeah, so we've gotten together.
Yeah, 11 o'clock.
All right, good. And this time, in the past couple of weeks, I've actually been in the chamber by myself. This time I'm just going to call in like everybody else. But we'll go around the table with all these departments that I just talked about, and you'll get a chance to listen in on their updates. So you'll hear from the police department, the fire department, the Westfield State College, and the Air Guard. You'll hear everybody kind of weigh in on what's going on. Tina Gorman will talk about what the folks are doing at the Council on Aging. Bill Parks or Bo Sullivan will talk about what is happening at the Boys and Girls Club. So you'll hear a complete sort of update on what Westville is doing with all the different segments of our community during COVID-19. It's pretty impressive.
And as usual, once the recording has been uploaded to usually in this case YouTube, I get that link out to various places on social media so that information can go out.
Good. Yeah, and it's also available at the website again, if I'm not mistaken, so people can actually listen to it and hear for themselves what their departments are doing.
Kathy, anything for Mayor Humiston before I ask him for his dad joke of the week?
Oh, yeah, do we have to have the dad joke?
Yes.
I spent a lot of time down in third grade. I think I've heard most of these.
It's in my contract. I don't do the show if I don't
No,
do the dad joke.
I think you pretty well covered it. I'm glad you're back. I'm glad you're healthy. I loved the pictures from the hospital. Your garb was
I had
impressive
a
as
sweet
always.
Lovely. Hey, Kathy, I liked watching your show as well. It was nice to see you back on the stage at Westfield Theater Group, and I liked having you tell the story.
It was something Ken thought we should do, and we have a good time doing it. So I hope you enjoy it. But no, I think you've covered a lot. Thank you, Don, for doing this. The city needs it, and the city appreciates it. Thank you.
Well, you got a chance to hear people like Joe Rouse before me, and there are a lot of great professionals who work hard for the city who you'll never really hear about them. You might read about them in the paper infrequently, but they're doing their jobs every day, and they're doing a great job, and I'm very impressed to be with them, and I thank them for their service.
All right. And because humor is, in fact, the best medicine, what do you have for us this week?
Just a simple joke. Why don't sharks eat clowns?
Why don't sharks eat clowns?
Because clowns taste funny.
I can't buzz the boss. I have to let that one go. Can't do it. Not going to happen. Mayor Humiston, thanks for giving us another call this week.
Have a great week, guys. Take care of yourselves.
All right. Stay safe. Thank you.
You too. Bye-bye.